Here I have a 30-year-old female. Today I'm going to be doing her abdominal assessment, her musculoskeletal assessment, and neurological assessment. So I can see that her skin is warm and dry throughout. She's in a pleasant mood. She is alert and oriented times four. Her posture is very good. We're going to get started on the abdominal assessment. So I'm going to have you lay down. For video purposes, I'm going to keep her shirt down. But her skin is warm and dry, and I don't see any open lesions or wounds. There's no protuberance, there's no distension, and when I look, I don't see any pulsating noted from the abdominal aorta. Next, I'm going to auscultate her bowel sounds. So starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. I do hear bowel sounds in all four quadrants, which is normal active. Next, I'm going to auscultate her vascular sounds. So we're going to start with the abdominal aortic artery. So we're in the epigastric region. So I don't hear any bruits, which is good. We're going to go next down to the renal arteries. Okay, so no bruits with that. Down to the iliac arteries. Good. Okay, so I don't hear any bruits upon auscultating all of the abdominal arteries. Next, I'm going to percuss all the quadrants. So I want you to tell me if you feel any tenderness even when I'm percussing, but I'm just going to be listening for the sounds. Okay, any tenderness? Okay. So I hear some tympany over the abdomen, which is normal. I'm going to percuss over the chest up here. Okay, and I hear some dullness over the liver, which is normal, and I'm going to percuss over the spleen. Okay, so there's some dullness over the spleen as well, which is normal. And I'm going to now percuss over the suprapubic area, which the patient's bladder is empty, so there should be no distension, which I don't feel. Okay, so there's some dullness over that area as well, which is normal. Next, I'm going to do some light palpation. So I'm going to start with my fingertips and just go about 1 centimeter into the abdomen. And no tenderness should be noted, but you should tell me if you feel any tenderness. Okay, is there any tenderness? Okay, so there's no tenderness when I do light palpation, but now I'm going to be doing a little bit deeper palpation. So let me know if you feel any tenderness with this. Any tenderness? Okay. So there's no tenderness, and I don't feel any bumps or masses or anything like that, which is normal. Now I'm going to palpate the abdominal aorta, and I'm feeling for any pulsation. And I don't feel any pulsation. Okay. Okay, so that can be normal. If the patient were malnourished or anything like that, you would feel it. You would typically feel it a little bit more, and you could see it. So now I'm going to palpate the liver border. So I'm going to just come around onto the into the right side of the lungs, and I'm just going to hook my fingers underneath, and I want you to take a deep breath. Okay, so I do feel the border of the liver, which is normal, and it doesn't feel enlarged, there's no tenderness, and there doesn't seem like there's any inflammation in that area. So next I'm going to palpate the kidneys. So what I'm going to do is, for the left kidney, I'm going to hook my left arm around her back and push forward. With my right hand, I'm going to just kind of go under the ribs and push down. Okay. I'm going to do the same thing on the left side. And I don't palpate her kidneys, which is normal. Okay. And next I'm going to palpate her spleen. So I'm going to do the same thing. I'm going to hook my left hand underneath, kind of push forward, and palpate underneath the ribs. And I don't feel any enlargement within the spleen, which is normal as well. So next we're going to go into the upper extremities. So I'm going to have you sit up. So I'm assessing the clavicles. They are symmetrical. Her shoulders are symmetrical. I don't see any deviations. And from looking at her scapulas and feeling across her back, they are symmetrical. There's no hollowness. I don't see any discrepancies. Her arms are equal length at her sides. I'm going to palpate over the joints. So her acromioclavicular joints feel intact, and her supraclavicular joints feel intact. I don't feel any deviations, mobility, anything suggesting maybe a fracture or a dislocation. Those look good. Next, I'm going to assess her range of motion and her strength in her neck, shoulders, and elbows. So I'm going to have you just bend your neck forward, bend your neck back, bend your neck to the side, other side, and then look over your shoulder on both sides. Okay, so she has full range of motion with flexion, extension, lateral bending, and rotation in her neck. Next, I'm going to do shoulder range of motion. So I'm going to have you bring your arms up, out to the side, all the way, touch your head. Touch your hands over your head, good. Okay, bring them forward and back. Okay, and then just bring them across your body. Good. So she has full range of motion with flexion, extension, abduction, and adduction, which is normal. Next, I'm going to have you stick out your arms like this, and then bend your elbows up all the way. Try to touch your shoulders. Good. Come back out. Good. And then bring your elbows in 90 degrees and turn your palms in and out. Okay, so she has full range of motion in her elbows. The arm flexion should be about 150 degrees when she brings them to her shoulders, which is good, which is normal. And then when she brings them out to 90 degrees, she's able to supinate and pronate. So next we're going to do the reflexes. So I'm going to start with her biceps reflex. Okay. So just have your arm like this. Good. Good. Okay, so she has positive reflux in her biceps. Next, we're going to do her brachioradialis. Okay, so she has positive reflux in the brachioradialis. And next, I'm going to do the tricep. Okay, and she has positive reflux in her tricep as well. I'm going to feel for her brachial and radial pulses. Okay, so she has about 2+ pulses in both the brachial and radial areas. Okay, so next I'm going to inspect her hands. I don't see any swelling or open wounds or lesions. I don't notice any nodules. Tell me if you have any pain when I do this. Okay, so there's no pain upon percussion of her hand. Next, I'm going to assess the range of motion and strength of her wrists. So I'm going to have you bend your wrist forward, like that. Okay, good. Bend your wrist back. Good. Okay. Now push down on my hands. In and push up. Good. So she has good strength in her wrists, both flexion and extension. She had about 90 degrees of flexion and about 70 degrees of extension, which is normal. So next we're going to go into your hips. So I'm going to have you stand up. I'm going to just palpate her ASIS and her PSIS, and I want you to tell me if there's any tenderness. So she doesn't have any tenderness over those areas. And now I'm going to assess her legs, her hips, range of motion. So go ahead and lie on your back. Okay, so with knees extended, I want you to raise one leg up. Good. Down. Other leg. Good. And now with your knees bent, I want you to raise it. Yep. Good. Yep. So she has about 90 degrees with her knees extended, which is normal, and then about 130 to 150 with her knees flexed, which is normal. So now what I'm going to do is assess the internal and external rotation. So I'm going to bend your knee. I'm going to go in, go out. Okay, so she has full range of motion with internal and external extension. She didn't grimace when I did that, so it shows me that there's no pain with that. So now I'm going to assess her extension and abduction and adduction. So lay on your stomach. I want you to bring your leg all the way up as far as you can. Good. Bring it out. Okay, and then if you cross it in towards your body. Good. Okay, now do the other leg. Up. I know there's a couch and you can do out all the way. And in. Yep. Oh, sorry. That's good. Okay. So due to limited assessment area purposes, she can only extend her right leg out so far, but I could tell she does have good range of motion with those movements. So now, as far as lower extremities, I'm going to have you sit again. So upon inspection, I don't see, her skin looks warm and dry and smooth. I don't see any swelling in her knees or any redness. Her alignment of her knees looks good. It looks normal. They're symmetrical on both sides. And when I move her patella around, it is mobile, and I don't feel any crepitus. Just relax your leg. Good. It is mobile, and I don't feel any crepitus. So now I'm going to assess the range of motion and strength of her knees. So I'm going to have you stand and just lift up like this. Good. Okay, now sit. Okay, so push. You're going to kick out and you're going to push against me. Good. Good. Okay, now bring your leg out and then push against me going in. Good. Good. So she has good range of motion and strength in her knees, which is normal. So now I'm going to go down to her feet. When I look at her feet, I don't notice any swelling, any deformities, and let me know when I feel around if there's any tenderness in the toes. Anything back here? Okay, so there's no tenderness upon palpation, and her Achilles tendons are strong, they're intact. I don't notice any foot drop when she was laying or standing. And now I'm going to assess, I'm going to feel for her dorsal pedis pulse. And the posterior tibialis pulse. So her pulses are about 2+ in each of those areas. What I'm going to have you do is just sit back so your legs kind of dangle. Okay, so I'm going to be assessing the range of motion and strength of her feet. So I want you to point your toes down to the floor, good, and then point them up towards you. Okay, can you bring them in towards you and out? Okay, and then press down, pull up. Okay. Good. Okay. So she has good range of motion in her ankles. She has good strength with dorsi and plantar flexion. So next I'm going to, we already palpated the pulses. We established that they're 2+. I'm going to do the reflexes of her knee. So I'm going to go right on the patellar tendon. Okay, so she does have positive reflex. Her legs kicked up. And now for foot reflexes, I'm going to tap on the Achilles tendon. Okay, so she does have positive Achilles tendon reflex. Her foot plantar flexed when I tapped on the reflex. So next we're going to do spine. So like I said earlier, her posture is good. It is symmetrical on both sides, but I'm going to have you stand up. And when I assess her arms, I could see that they're both at even length. Her shoulders are at even length. So now I'm going to have you turn this way. I'm just kind of feeling along the spine to see if I feel any deviations while standing. And I don't, so I'm going to have you bend. And I'm just feeling her spine here for any deviations, any protrusions, any curvature, which I don't. So her spine feels in line. So now I'm going to test for the spine range of motion. So just try to, as far as you can, bend and touch your toes. Okay, and then come back. Go extension, so try to bend back. Okay, and then bend to both sides. And rotate. Good. So it seems like she has full range of motion of her spine, which is good and normal. Now, next we're going to go into her cranial nerves. So I'm going to have you sit back down. So cranial nerve 1 is olfactory. I'm going to have her identify a scent. So I'm going to have you close your eyes and tell me what you smell.
Spearmint or something?
Yeah. So the scent is spearmint. And that tells me that her cranial nerve 1 is intact. And cranial nerve 2, which is her optic fields, I'm going to be assessing her peripheral vision. So I'm going to have you cover one eye. And then I'm just going to hold up in different areas a number, and you're going to tell me what you see.
2, 3, 1, 0.
Good. So her left eye is good. Okay.
2, 5, 4, 1.
Good. So her peripheral vision is intact on both sides, which tells me cranial nerve 2 is intact. And then cranial nerves 3, 4, and 6 all fall under the extraocular motor and kind of the eye exam. So I'm going to be doing the 6 cardinal fields of gaze to test this cranial nerve and for convergence. So I want you to follow my finger. Okay, so her cranial nerves are intact. for the optic nerve, the cranial nerves 3, 4, and 6 are intact. So now I'm going to test her corneal light reflex with this, and I'm going to be testing for if her pupils are equal, round, reactive to light, and if they accommodate, which looking at them, her pupils are equal and round. And I'm just going to look. So she does have a corneal light reflex in both eyes, and her pupils do react, and they do accommodate like I did before. So next, we're going to be doing the facial sensation, cranial nerve 5. So I'm going to touch her face with something, and she's going to tell me if she feels it or not. So I'm going to just go kind of around your face, and you're going to tell me if you feel it.
Yeah.
Okay. Yep. Good. Okay, and then we're going to be testing your jaw muscles. So I want you to clench. Okay. And then just open your mouth, and I'm going to push up, and I want you to just resist. Good. Okay, so cranial nerve 5 is intact. She has strong masseter and temporalis muscles. She was able to resist against me pushing up against her chin. Cranial nerve 7, we're going to be assessing the facial movements. So I want you to move your eyebrows up and down. Good. Smile. Frown. Good. So her cranial nerve, her facial movements are intact. And what I want you to do is have you squeeze your eyes tightly. And I'm going to try to open with my hand. Okay, good. So I can't open her eyes with my hands when she's squeezing tightly, which is good. That's normal. So now we're going to be testing her hearing with cranial nerve 8. I'm going to be doing the Weber and the Riney test. So what I'm going to do is I'm going to have this vibrate, and I'm going to stick it on top of your head, and you're going to tell me if you hear it on both sides. Yeah. So now what I'm going to do is I'm going to hold it here, and then I'm going to have it away from your ear, and you're going to tell me with both ones when you stop hearing it. Stop hearing it. Stop hearing it. Stop hearing it. Okay, so her Weber and Riney tests are both normal. Her air conduction is about 2 times longer than bone conduction, which is normal. So that tells me her hearing is intact. So now what we're going to touch on cranial nerves 9 and 10, which assess palatal movement and swallowing. So what I'm going to do is have you just open your mouth, and I want you to say, she's going to say ah, and I'm going to be assessing if her uvula and the palate and everything is moving normally. So just say ah.
Ah.
Okay, stick your tongue out. Okay. Okay, good. So everything moves. Her uvula moved midline, which is good. And now what I'm going to do is just have you swallow. Okay. So she's able to swallow, which tells me those nerves are intact as well. Next, we're going to be testing her cranial nerve 11. So we're going to be doing the trapezius and the sternocleidoid mastoid movement and strength. So I'm going to have you move your shoulders up and down against my resistance. Okay, and then push against my hand. Push against my hand. Good. So she has good strength and movement with those cranial nerves. And then cranial nerve 12 is tongue movement and strength. So I'm going to stick out your tongue, and then good, and then push up against the roof of your mouth. Good. Okay, so with that, she was able to push up against her mouth, And what I want you to do is stick your tongue out into your cheek. And push. Good. Push. Okay. So she has good strength in her tongue. So that means cranial nerve 12 is intact. So next, we're going to be doing the RAM test. So what I want you to do is have your hands flat on your thighs, and I want you to 10 times repeatedly go. Good. Okay, so she's able to quickly supinate and pronate her hands, which is normal. And so now I want you to place your right heel on top of your left shin and move down. Okay, and then vice versa. Good. Okay, so she has a normal heel to shin test. And next I'm going to use something sharp and something hot. I'll use something cold instead. So something hot, something sharp and something cold. And then I want you to tell me which side of this is going to be sharp, which side is going to be dull, and then when I'm touching you with something cold, if you feel it. Mm-hmm. So close your eyes.
Dull. Sharp. Dull. Sharp. Yes,
Yep. Okay. So she is able to feel the dull side, the sharp side, and the cold object. So next I'm going to test the proprioceptions. So I'm going to be moving her finger up and down, and then I'm going to be using the tuning fork to see if she feels the vibrations. So close your eyes, miss your hand, and then I want you to tell me if I'm moving it up or down.
Up, down, up, down.
Okay, and I want you to tell me if you feel this vibration.
Yes. Yes.
Okay. So her proprioceptors are intact, which is normal. And next we're going to do the cortical sensations. So we are going to be testing the stereognosis, the graphesthesia, 2-point discrimination, and extinction. So the eyes are going to be closed for all these tests. And I'm going to have her hold something and tell me if she can identify it. I'm going to then trace a letter or number in her palm and ask her to identify it. And then I'm going to have her, I'm going to give her another object to see if she can identify that as well. So close your eyes. Okay, and then tell me what object this is.
Phone.
Okay. What object is this?
That like oil bottle thing.
Okay. All right, so she's able to identify those objects. Now I'm going to trace something in your hand. I want you to tell me what it is.
A Y? Oh, A.
Yeah. Okay, and we'll do this hand. 8. Good. So I traced an A and an 8 in her hands, and she was able to identify it. So now we're going to be doing some of the standing assessments. So I'm going to have you stand, and I'm going to have you start over here. Okay, so her standing is symmetric. There's no swaying. She's stable. And I'm going to have you walk towards me. Okay, turn around, walk away. Okay, good. And then walk on your toes towards me. Okay, other way. And walk on your heels towards me. Okay, other way. Okay, so she's able to perform all of those normally. She walked in a straight line. Now what I'm going to do is test for the Romberg sign. So I'm going to have her stand together with her feet together, eyes open and eyes closed, and then we're going to check if there's any swaying or imbalance. So stand with your eyes open just for a couple seconds. And I don't notice any swaying or imbalance. Okay, and then now her eyes are closed, and now I don't notice any swaying or imbalance with this either. And so now what I'm going to have you do is hold your palms up like this, and I'm assessing to see if there's a drift, which I don't see. Now close your eyes. Okay, so I don't notice any pronator drift for this as well. So this patient, everything is within normal range for her. She has good range of motion with everything, good strength. Her abdominal assessment seemed normal, and that is it.